Can we have everyone inside the hall? We are bringing in the coupons for the lucky draw. We will start the post-lunch session with one round of lucky draw. I'll request everyone who are outside to come in. Can we get the fish bowl for the lucky draw? एक ही करें. Are most people inside the hall? Then can we have the lucky draw fish bowl here? One round. Okay, so I think the lucky draw bowl is getting ready. So meanwhile, I think we would start with the panel discussion, and primarily just to inform all of you that we are running behind schedule. So to sort of make up on time, we are deciding to integrate two panels together, and obviously the underlying theme, there are a lot of similarities, and perhaps with so much talk being about integration, this will not be out of place. So basically, the panel is on Health 4.0, a vision for smart and connected healthcare and digital hospitals of the future. For this panel, it's my pleasure now to invite the panelists on stage. Can we have Dr. Rakesh Gupta, Chairman, Sarvodaya Healthcare? Dr. Rakesh Gupta. Okay, he might be outside, so let Dr. Gupta join in. Then we have Dr. D.K. Gupta, Chairman and Managing Director, Felix Hospital. Yes, sir. Can we have a round of applause? Can we have on stage Commander Navneet Bali, Senior Vice President and Group Head, Narayana Health? Can we have on stage Dr. Samir Singh, VP Clinical Services, CK Birla Healthcare? I'd like to welcome Nilesh Shinde, Group Chief Technical Officer, Jupiter Hospital. Here he is. Dr. Biren Chauhan, Group CEO, Sunshine Global Hospitals. Saurabh Gupta, Regional CEO, Kim's Hospital. Ekta Modi, CEO, Parul Shevastram Hospital. Then from the solution provider side, can we have Bhupesh Arora, Business Head, Digital Energy Division of Schneider Electric? Dr. Anil Muniappa, Head Healthcare Transformation at Cloud4C. And is Dr. Rakesh Gupta inside the hall? Okay. Yes, sir. Great. So primarily, the focus is on Health 4.0 and digital hospitals of the future. So I will start with you, Dr. D.K. Gupta. When we talk about Health 4.0 technologies, we talk about applications around artificial intelligence, Internet of Things, and during the morning inaugural session, we heard quite a few applications of AI in the healthcare sector. Even IoT also we heard about. And during the earlier panel discussion, there were talks about measurable business outcomes. So my question is, how can some of these Health 4.0 technologies, AI, IoT, and the likes, how do they improve the patient outcomes? Because ultimately that is the aim of any digitization in the healthcare sector. And how can it enhance the overall quality of how healthcare is being delivered?
Thank you so much and good afternoon to all of you. And thank you for being here. I think the prime objective of any treatment given to patient is first, quality of treatment, second, safety of treatment, third, patient experience. If we talk about AI, IoT, or any other things like robotics, artificial intelligence, beside that, AR, augmented reality, VR, virtual reality, or we talk about machine learning, they all contribute to the patient's ecosystem in different forms. If we talk about AI, definitely AI helps in predictive, as you were speaking just before this session, prediction of disease, risk factors, prevention of them, early diagnosing, screening, and in treatment also. They are helping in all the stages of 4 or 5 steps of patient treatment. There is a process of treatment. It starts from predictive, preventive, and early diagnosis and treatment, finally the prognosis and outcome. We can enhance outcome of treatment process at each step with the help of AI or IoT or integration of all the equipment with AI or IoT, so that different parameters, different risk factors, different sign and symptom, different diagnostic results, they can be integrated, and based on this integration, the doctor can be empowered to take wise or precise decisions. So that diagnosis is good and the precision of diagnosis is good, treatment is precise, is specific, targeted, and the outcome will be definitely good if we use all these technologies in the treatment process. Thank you so much.
Okay, thanks. Exactly for setting the tone of the discussion. Commander Bali, I'll come to you with the same question. Basically, how these so-called Health 4.0 technologies improve the overall healthcare quality in terms of what healthcare is being delivered to the patients.
Thank you so much for inviting me here today. And I think these post-lunch sessions are very interesting because everyone is trying to keep awake, but I'll make it a little interesting for all of you. So we have a very broken healthcare model today in India. If you really look at it, you just cross the borders of Delhi and move towards cities, the smaller towns and cities. You will see the disruption has happened in almost every walk of our life. IRCTC enables everyone sitting in one remote village in Tripura or Jammu Kashmir to book a ticket. Aviation has been disrupted. We do it in a very fine manner. Your movie tickets, the whole ecosystem is disrupted. Everything from food business to everything is disrupted. Look at healthcare now. I think we are far from even looking at the tip of the iceberg. We talk about AI, we talk about IoT, we talk about all these technological advancements, but again, at the user end, it's quite chaotic. The hospitals have got thousands of applications running. The users actually are quite confused. At the patient end, again, it's quite chaotic because despite the fact that we have so many of these advancements happening, but still, today also you go in a hospital, you have patients fighting over a bill, you have kiosks in the OPDs, both in the public and private healthcare systems. So we are far from where we should be, even though that we do talk about a lot of technological advancements. Look at the medical part of the story, where, as you remember, there was a software called IBM Watson many years back, which sort of wanted to make medical oncology treatments based on algorithms of many data which were taken from the Caucasian genes, and they wanted to be very specific onco treatment. But then I think it was slightly ahead of its time. But in that part of the medical paradigm, you have got huge advancements which have happened. So you have robotics coming in, you have doctors who are today treating patients with more easier ways. There is less blood loss, less pain. We have genomics coming in. We have a lot of advancements which have taken, which actually have contributed immensely to the overall outcomes of the patient care. The last bit of the ecosystem, which is again chaotic, is there are three main players as far as the care ecosystem is concerned. There are the hospitals, there are the patients, and there is the insurance. And all three of them don't, trust each other. The patient doesn't trust the insurance company doesn't trust the patient doesn't trust the hospital. And, there is a huge amount of mistrust. Just to compare with aviation industry, when you sit inside an aircraft, you don't ask the pilot, how much aileron or how much rudder will he use when he has to bank 30 degrees, 40 degrees. But all of us are very well, educated today. We go on the Google and, try to look up every disease and every treatment possible. The reason is because there's a huge amount of mistrust. So in my viewpoint, as technology advances, first of all, there has to be a complete sense of a seamless, evolution where the true disruption in healthcare will happen, which we are very far off. The second important revolution which will happen in healthcare is the revolution of trust. And I think that will be driven primarily in India by insurance, because when the patient doesn't have to pay from their pocket and someone else is paying for them, that will disrupt the entire healthcare industry. That's all as of now. Maybe we'll talk more.
Okay. So, the insurance part of the healthcare ecosystem, as you rightly said, is a critical aspect, and maybe we might be slightly glossing it over today's discussion for paucity of time. So I'll connect this Health 4.0 with how a digital hospital would look like in the future, and come to you, Dr. Sameer Singh, with the question of, if we extend these digital technologies, AI, IoT, then we talk about patient portals, different kind of mobile applications. So in a digital hospital, within quotes, what we mean by digital hospital, how can these technologies, in your view, improve the patient experience and more importantly, uh, just not the experience, but at an affordable rate? And one important thing, one of the panelists mentioned, the moment we are going beyond Delhi, or so in hinterland, our connectivity, it's not uniform, the quality of connectivity, if we may say. So when we are talking about adoption of these technologies, how would you factor in things like the cost and the quality of connectivity also?
Sure, sir. Thank you for the question. A very good afternoon to all of you. I'll keep it simple, sir. I think your question, if I have to look at the entire gamut of patient experience, safety, quality, I would also call clinical outcomes, governance, things like this integrated together. There's so many apps, there are so many mobile applications, there are so many portals, there are so many, I think, sites, tools, AI tools available. I think the hospitals, based on its capacity, has to think what is vital, what is essential to them, and what is desirable. So what is vital to a patient if it's a small niche hospital and diabetes, management or diabetes care, or antenatal if you're a niche specialty of women and child healthcare space, or you're a boutique hospital. Probably if you would like to look at something which enables only those, their prenatal to, reminders, they have had food, nutrition, there are tools available to monitor your diabetes care plans, things like this. So if you're a single specialty or maybe a surgical super specialty hospital focusing on that, so just the pre-operative preparedness, post-operative, how you're standing, infection control being checked, your implants, are they doing fine, your AI outcomes. As a clinical governance team part, maybe I would like to have my dashboards, which I could publish on my website. People in US actually make a choice. So if there's a society called as Society of American Gastroenterologists and Endoscopic Surgeons, SAGES. So there, every endoscopist has to put up their data on month-on-month basis on what is their polyp detection rate, how much time they spend in a colonoscope, how much time do they take to withdraw the colonoscope, and based on that, the patient makes a choice on whether the doctor is great or not. If you look at Saudi Arabia, there even doctors' credentials are embedded in, because they're already there. They're all, say, maybe 14 hospitals are all JCI accredited. Next, so based on the doctors, the OT doesn't take that code inside. So I don't have to have a medical affairs committee which postmortems, why did this surgeon do this? So, you have to choose what is critical to your business. Of course, if I'm only thriving into a niche area of, say, service excellence, I may want to even have an app which allows me to read any by a particular group, say Times of India or someplace across. I've seen that with Manipal. You just come, scan, you can read any magazine, today's newspapers, as long as you're in the hospital. In Manipal Whitefield, when we were commissioning it, if you're crossing my vicinity and somehow you were looking for an ENT appointment, not necessarily in my hospital, the AI providers across will actually trigger you a message that, hey, this and this appointment slot at ENT is available now.
Okay.
Even if you're crossing in a public transport just outside my hospital. So people have thought to those levels. There's a mini Google map. You enter in, it'll tell you go to the reception, turn left, third opening on the right is the OPD room you have to go to. So there's no requirement of a receptionist, and which also kind of tailor-mades. If I've prescribed certain tests to you, what is your order? Go to the lab first, then wait at the CT. Probably your waiting time is 20 minutes. So, you pick and choose what is critical to you, to your business.
Exactly.
If it makes sense. Thank you.
So many of the solutions you're talking about are more preemptive in nature. And that's very interesting. And some of the, but I'll come to the next speaker, Dr. Biren Chauhan, with the similar question. But my question is, while we are talking about some of these solutions, and again, the point is, how overall as a country, and when we are looking at this humongous population of 1.4 billion and addressing the health, how standardized it is, or is it still restricted to only certain super specialty hospitals. And so to spread it, become more mass oriented, I think affordability will definitely be one part of it. The other part would be standardization regime, some sort of standardization. So where do we stand there in your
Good afternoon, everyone. As my co-panelist, Commander Dr. Bali is there. Yesterday we celebrated Kargil Vijay Divas. So on behalf of everyone, we join you and wish you as you represent the Indian Armed Forces, and we all are proud of our Indian Armed Forces. Right? Big round of applause. Coming back to your question, how about the standardization? I'll quote one example of country which is New Zealand, very tiny country. Few years back, they had a typical problem, huge waiting time. Patients were left to suffer because they were getting dates for the surgery, even in the elective procedures. They come out with the equity adjuster scoring. It considered 4 things: ethnicity, geographic location, level of income of level or deprivation, and how long the patient has waited for his surgery. And they run the AI algorithms, they come out with the adjuster, and based on that, the patient was given the priority. The outcome was that after a couple of years, the mortality because of the patient waiting to get themselves operated drastically reduced. And that's how the AI made a significant improvement in the health and well-being of the entire nation. Right? In India, so few days back we were discussing with the Quality Council of India and all. I give you example, some small village patient with an Ayushman card coming to a super specialty hospital, getting the angioplasty done, getting discharged, NHA reimburse money to hospital, of course, after 2, 3, 4, 6 months, right? Then I went to the same village, inquired to the patient that, are you taking the follow-up medications so that your stent doesn't get, restenosis or something like that. That patient was so poor, he said, card tha isliye I went there and get the procedure done, but I don't have money to buy the medicines, right? And in that village, next to his home was the primary health center. In this entire picture, PHC was left out. Are you understanding? Right? PHC was left out. Then again, in Ayushman, to get the money, hospital is sending and registering all the documents digitally. We are submitting to the Ayushman board, the NHA and the concerned authorities. PHC also has a doctor and the internet connectivity, but nobody is sharing the data with anyone. Right? Imagine a scenario, if there is a trigger that so-and-so patient from so-and-so village or so-and-so address getting discharged from the hospital for any of the procedures under Ayushman, and that particular nearest CHC or PHC or sub-center gets an alert. They are sending the multi-purpose health worker or the Anganwadi workers to the patient's home and ensuring the compliance. Imaging what kind of a good health or good well-being we can achieve in a country, right? So I think there comes the question of standardization. But before that, whatever we have to start sharing with each other, right? Private hospitals and public hospitals kind of a segregation cannot work in India, because now we have a lot of connecting platform of ABDM, Ayushman, insurance, IRD, everybody has a platform. Why can't we just start sharing the data, raising the triggers and making the change in the individual's life so that the health and well-being of the nation can improve, right? So that's it for the now.
Exactly. Very pertinent point you raised. And while you raised the challenge when you mentioned the PHCs were left out in the network, we heard the positive side of it in the morning when the AIMS Bhopal director was making the presentation. Said how I think 50 odd PHCs from very Adivasi dominated areas were brought into the network. I'll come to Ekta next. The similar question, this gap, this health 4.0 technologies we can talk about, but how can this bridge this gap in healthcare access? How you access healthcare? What are your solutions, or not solutions, I would rather say the roadmap that you planned?
Thank you. So I think I can relate to this because I represent a medical college hospital, which is located in a rural area, which is away from the city, like 25 kilometers away from the city. And we used to have this question every day, like people don't have access to their records. Plus, 90% of the people we treat are from PMJY, that is the Ma Yojana category. So a lot of brainstorming went into that, and we being the medical college, we do want to develop the future doctors also. So we developed a skill lab, which I think the idea was discussed in the morning itself. So we have a skilled lab which empowered the doctors, the students to have a grip on the patient care processes. Plus, a very brainstormed norm which I personally use in my operational excellence is AWATAD, that is all at ad, that is anywhere, anytime, any device. So, with this thought in mind, we became the first medical college hospital to be paperless. I'm very glad to share that we have a paperless system at our hospital. Although we have 90% of our patients from rural areas, we have equipped trainings to them to have their records in their mobile. So the patients coming at our hospital now having patient education videos in their mobile. How to take insulin is a very common thing, but we have videos filtered in the patient's device or the relative's device, wherein they can watch. Patient's education is on their fingertips. Their reports, their discharge summaries are on their fingertips. Because as Dr. Biren rightly said that the follow-ups, there are many loss to follow-ups when it comes to patient. So most of the patients go to PHC or CHC or to the nearest clinic. And at times, majority of times we know, we don't get a file or a paper we want. That's a irony we all have to agree. So the PDF reports, everything is there in their mobile. Even
Okay.
the digital solutions coming up, we have integrated X-ray films and everything which can be scanned in their mobile. So I think by this, even their transportation is digital. Everything is digital. So when they come to the hospital, they are now seamless. They don't have to find anything. They even urge us कि हमारे पहले वाले जो फाइल के रिपोर्ट्स है वो भी आप इसमें स्कैन करके डाल के दीजिए. So I think that's a pure change which I see as a medical college hospital in a rural state of Gujarat. Thank you.
Okay, thanks. Saurabh Gupta, I'll come to you next in similar question on the how this digitization or the health 4.0 or these technologies, however way you talk about improving the patient outcome and more importantly bridging the gap that is there.
So first of all, thank you very much for inviting me here. Just for a second, I would like to visualize how the Health 4.0 hospital will look like. So there are three buckets. One is predictability, the other one is repeatability, and third one is extendability. So let's touch all three buckets. So predictability, and we have analyst panelists which spoke about things like IBM Watson. So that is of course tip of the iceberg, and now we are speaking about ChatGPT and other AI-based models. By the way, one day back, I think the Android and iOS application has also been launched for ChatGPT. If you have not installed it, please install it. By the way, ChatGPT is now as powerful as 70% of the human brain. So it processes over 100 trillion parameters. That is almost 70% of the human brain. So it is ever increasing. Now, as I said, three buckets. So the hospitals will be more predictable. It will run AI-based algorithms to actually arrive at a patient diagnosis and the probable treatment. In our organization, we have actually tied up with multiple companies. So 90% of our X-rays are actually scanned by an AI-based algorithm. And what happens is you actually lessen the load on the radiologist. So at the end of the day, only 10 X-rays are there, which needs to be examined by the radiologist. So you enhance the capacity. So the capacity is enhanced. The second thing is, as I said, in predictability, you also have patient. So we were talking about patient. There are a lot of black boxes in hospital. If you see from a patient viewpoint, so things like OR, ICU, a surgery was there for 3 hours. It has gone into 5 hours. Nobody knows what is happening. So we are also working, and there are some hospitals which have already installed a tracking mechanism in which you can actually see how the patient is progressing through the various steps. So that is predictability. You actually comfort the patient and patient attenders what is happening to the patient. There are, devices and apps which are available in the market which tell you, like in COVID times, there was a, app developed by my erstwhile organization which used to tell the daily parameters of the patient, and it was auto. So that is predictability, and it actually enhances the patient experience. Also, it allows to enhance access, because whatever we say, we have shortage of manpower, we have 75% of the facilities near the tier 1 cities, and now of course we are moving to Bharat, so people are moving into tier 2 cities. But whatever you say, with the pandemic, we have seen that this bridge will never be bridged. This gap will never be bridged, sorry. There will always a deficiency of people, manpower, as compared to the newer diseases which are coming. So technology is the answer. Because, telemedicine, of course, everybody talks. I am also talking about telemedicine. There was a no business model. Now, majority of the follow-up surgery consultations in many hospitals actually happen on that. And the third thing is comfort and convenience. Basically, patient is empowered to actually consult from his home, to check his test report with the basic things. And with the advent of more and more digital softwares and AI-based technology, I'm sure that, mood-based lighting, and there are many things which you can do to make the patient experience joyful and convenient in a hospital. That is about to come.
Okay, thanks for being so comprehensive. So I'll come to you, Dr. Anil, now. Now you have heard many of the healthcare people talking about how, if I may say, a smart hospital would look like in the future, with adoption of more Health 4.0 technologies. My question is, as a solution provider, how can you help these smart hospitals offer these next-gen kind of services, even as these hospitals sort of undertake a digital transformation?
First of all, thanks a lot. I mean, a light panel here, right? So I'm the only one from the solution side. So all of you are against me. So I'll just speak about initially what we spoke here about, how is IoT, right? IoT market in India is currently 1.3 billion USD. In next 2 years, it's going to be 2 billion USD, right? What wonders me, I mean, I'm really shocked, is why are hospitals not getting into this business as such, right? Because the data which is generated out of that actually should have been in hospitals. Am I right? I mean, we open hospitals for clinics for sugar, kidney, hair, nail, everything, right? IoT is going to become IOB for healthcare in coming years. IOB is something like it will automatically detect whether you're wearing a mask or not, right? Right? And I also wanted to tell you that, when you have an IoT device, right, or an AI that needs to come in India, right? We usually study about outcome or value that you generate is always equal to quality by cost, right? In India, where we have a limited spend of GDP, right, for 1.3 billion people, I would bet all my houses on early detection of diseases, right, and prevention of those. I'm not talking about all the riches here who actually go and check your, every 10 minutes you will go back and check your, heart rate, SpO2, all of that, right? I'm talking about the actual Bharat, where 65% of the diagnostic tests that are done in radiology are actually chest X-rays, right? So we need AI to actually help entire Bharat to actually come out with AI solutions for detection of diseases, detection of tuberculosis, chest diseases. We spoke about it in the morning, right? That is where I think Healthcare 4.0 is going to make a huge change there.
Thanks. Nilesh, I'll come to you next. While we have been talking about different aspects of smart hospital, the digital hospitals of the future. One important thing in the design of such a hospital is having the energy efficiency, the sustainable building, if I may say. So what are the, according to you, what are the things that need to be done there?
I will have to put in this way. If we consider any hospital, then if you say the electrical consumption of that, then HVAC, heating and that constitute almost 50% or 55%, depending on how they are going to take care of HVAC side. But normally it range between 45 to 55% of the entire electrical consumption which has happened throughout the day. Then what is the next is like medical equipment. When I'm saying medical equipment, you consider CT, MR, anything, that will consider only 9 to 10%. Other equipments which we use for OT, ICU, or which are there on the UPS, this is data which I am comparing with my 3 units which are there. And one of that has already got energy efficient award also for Ministry of Power. So I'm comparing that data only. So what is next is like UPS equipments, that is around 10 to 12%. And raw power or maybe the lighting is considered around 9%. This is the more or less if we consider this fact. So when we are designing something and when we are talking about net zero carbon or decarbonization, so what are things which is important? One is that HVAC. And when it will happen that during hospital construction, if we take care of that issue, then definitely energy efficiency is going to happen. Now, what is important, which is the one thing which is very, very common thing which we normally miss, is that normally the top slab of the any hospital building is having maybe 6-inch or 8-inch, whatever the RCC slab. Normally we do waterproofing on that. Okay. Now there are two concepts. One is that over-deck insulation or under-deck insulation. If we do over-deck insulation, the U value, which is like we saw that thermal transmittance comes down drastically rather than doing under-deck insulation. Which first, over-deck insulation makes huge impact. So everyone has to do that. Maybe 100 mm, 4-inch ka bhi ek layer, if you put it, it is going to make huge energy saving because that type of sunlight will not enter inside the building. Now, whatever the exterior side, instead of brick wall, if we do AAC block, definitely it is going to make a huge difference. Now, similarly, if you see medical equipment, now medical equipment, whenever we design, temperature and humidity plays an important role in any medical equipment. So everyone will say, any service provider will say, or equipment provider will say, humidity has to be maintained below 60% RH. So if you want to maintain it, either you have to use electrical heat stripper or you can have a hot water coil. So for that, if instead of electrical heat stripper, if you use a hot water coil, it is going to make a difference. But now everyone is talking about digitization, everyone is talking about BMS. Now one point which I'm going to tell you and which is unique and which I'm doing in my hospital, if you see that, because I'm basically a medical engineer, if you see the companies, they will say that the operational temperature requirement for CT scan, MRI, cath lab, LINAC or PET CT is 22 degree. They will say 22 degree is a requirement. Now we will set our temperature according to that 22 degree. But believe me, if you see that their main data sheet, that will say it is 26 degrees is also okay. Okay, so see the difference. Now, if I'm putting on 22 degree for throughout 24 hours, I understand that 22 patient comfort, we require 22 degree. But when there is machine like CT scan, MRI, all these machine for 10 hours, it is not working. So can we put it to 25 degree? Yes, it is possible. And by doing that, now here the BMS has to play important role. We are talking about BMS, but it is not happening in that way. That it has to sense that there is nothing is there now, and it has to go up to 25 degree. And it will make huge saving as per the HVAC is concerned. So these are the points we need into consideration. Then similarly, like CSLD.
Yeah, I'd like to maybe due to constraint of time, we'll take it up maybe offline the other point. What Nilesh had said, and on that I'll come to Bhupesh. We know Schneider is one of the global leaders in energy management. So in light of that, what is your vision of a connected and smart healthcare facility? And we heard Nilesh also talked about the design, the hospital design. So what are your views?
So I'll take it from where Nilesh said. Primarily, I think BMS or HVAC happens to be one of the most important piece in any facility, irrespective of healthcare or any other building. So they consume most of the electricity. But I think when we talk what technology can help any facility like healthcare to be at peace is primarily a company like Schneider, which brings solutions, help connect all the assets in a way that they are able to deliver the performance for which they are designed for. So patients or doctor are not there to worry how the facility is going to be there. So you need to have a reliable power quality available so that the equipments are running fine. The patients are at peace that the procedures which are going to be performed in the hospital, they need not to worry. The doctors need not to worry whether the OT room will be ready or a reliable power will be there or not, or the ambient temperature, whether the relevant humidity or temperature to operate the machines and equipments are there. So that is where I think the technology comes very handy when it comes to the solutions what we can do, both on the energy side, even on the HVAC side, also what Nilesh was talking on the BMS side. So this plays a huge role when it comes to delivering the quality of infrastructure, what is required to deliver the services to patients for which they are in the hospitals. So reliable power primarily for the equipments and the environment primarily to perform the procedures. Patients, when they come, they may come for an emergency services or even for the planned procedures in the hospital. So they need not to again worry how they will be taken care in the hospital, whether they are in the room or moving in an OT room where their procedure is going to be performed, or in the resting room and then going back to the room. So there is an interconnected system which can also get embedded in an overall BMS system, which can take care of the movement of the patient also, apart from managing the ecosystem of HVAC which is there. So today, the BMS has expanded beyond the capabilities of only managing the HVAC system. You can integrate plenty of systems inside the hospital, be it your nurse calling system, be it your patient movement system, or the OT room performances, or the availability of these rooms for various procedures, including the maintenance facilities or the housekeeping, because after every procedure, the room needs to be sanitized and kept ready for the next procedure also. So all these systems can be digitized primarily to bring a lot of efficiency for the healthcare facilities, wherein companies like Schneider can come in and help those healthcare facilities to become the state of art and the best facilities in the country.
Okay, thank you. Commander Bali, I'll come to again with a question on, we talk about Health 4.0 technologies and adoption. What are the ethical implications, according to you, of some of these adoptions, and how are hospitals able to address those ethical concerns?
Let me just give you a small scenario before I come to the actual question. 140 crore people, out of that 80 crore of us do not have any access to insurance panels or anything. 7 lakh beds today in the country, 30% more required as per the Niti Aayog. So that means 10 lakh beds. Let's say 50% of these are cash paying patients. At an ARPOB of 25,000, you're spending 120 crores every day out of pocket expenditure in our country. Now come to the connected healthcare paradigm, and let us say you have everything built in together. As far as ethics is concerned, I think we are centuries away from even thinking about this question. I've never heard in last 8 years of my healthcare panels that I've addressed so far. So nobody has ever even touched about it. So that means, except for maybe the ethical committees that we have in our hospitals, which look into many of these trials, etc., I think we are nowhere even thinking about it, as much as we are not thinking about sustainability and ESG. My friend Karan is sitting here from Apollo, and he does a lot of work in that. So I think we are centuries away from even, and today I think you've put this thought in my mind, maybe I'll go and look into the ethical part of IoT and AI. I've never thought about it ever in my lifetime. But yes, to just give a closing comment, the answer to India's healthcare problem is not about coming to the hospitals. We should not take pride in having 12,000, 16,000, 18,000 OPDs per day. I think we should take pride when we have no OPDs at all, or we have minimal OPDs. And I will call an Indian healthcare system connected when most of these things are happening remotely, where patients actually don't have to travel, don't have to go to hospitals at all, except when to be inside an operation theater or under a LINAC or under such a costly machine which you can't do at home. And that's the scenario, I think, which will happen maybe 5 years from now or whatever. But that's the connected healthcare that I sort of dream of. And I think that is the way India, because treating 140 crore people with the kind of GDP spend of 1.5%, having a tax base which is absolutely poor, this is never going to happen at all. Thank you.
Great. And thankfully, you have mentioned that such a connected healthcare scenario is likely to happen in 5 years, and that's not centuries away. Thankfully, I'll keep an open question. Anyone on the panel can pick it up. Maybe ethical, as Commander Bali mentioned, might be raising the bar a little higher, but more on the, especially as we're talking more on telemedicine, teleconsultation, remote consultation. What about the data security, the patient data privacy and security on these aspects, especially when we're talking about next-gen technologies? How are these futuristic hospitals looking at that scenario? It's open. Anyone can take it up. Yes, sir.
I take this question because just around COVID, when he was here, we were a part of a working group which was developing an app for the industry called as Swasth app. And we're proud to tell you that later on we submitted this app to Government of India. And now the National Health Authority manages it. And I was at Apollo in Bhopal in central India. And it was great to see that app. The developers were there with our hospital, giving us on how to document for Ayushman Bharat. And they were talking about how the data would remain confidential, how the data would flow between private and different sectors of the patient would have been seen there at Delhi and then would come down here at Bhopal and things like this. So when we were working on those lines, there were a lot of IT brains around there. There were people from, you name a hospital chain, the CEO was there as a part of the working group. So they did ensure that the relevant data stays with them. The data doesn't flow to, say, probably companies which are going to develop products or maybe only extract data and counter sell it to somebody. But if it's actually working on to public-private partnerships or public domains where, maybe targeting only diabetes or breast cancer screening or, somebody who's early anemic or something to do with the diabetic retinopathy, neonatal metabolic disorder screenings, things like this, we wanted the data to be available everywhere so that you get to learn with riders about, there are 2 or 3 data which needs to be confidential as per statute, which talks about MTP, HIV reports. So those things ensure that if there is a positive turnout, the data is just blocked out. And it's only the authorized one has to go through the supreme, whatever, channelizes there across, which the IT team, I think, would be in a better position to answer. But I think it is being addressed, it is being thought upon, and I feel probably not as far away, but surely around the corner.
Okay.
Right?
Yeah. First of all, I'd just like to take a step back, right? We're all talking about 4.0, but honestly, hospitals, are our clinicians actually capturing and entering all the relevant clinical information back to the systems? A honest answer would be no, but for the sake of discussion, let us assume that yes, they are doing, and we move forward, okay? Data security I've been hearing since morning, right? The first thing that we need to do is to have a third-party security audit on your data security, right? I would like to bring in an offer here. I mean, being very honest, please visit our booth. We would do a free of cost data security assessment of your hospitals, right? I'm with you on this, right? So my folks are already there. People also spoke about vulnerability testing, all of that, right? But in India, we always believe that, Murphy's Law. If something needs to go wrong, it will definitely go wrong, right? So let us look at it from a positive perspective. If something good needs to happen, it will definitely happen, right? All I need the hospitals to actually plan is, in case of a data breach, what is your response plan? Keep the document ready, right? We have, emergency cards ready in our hospitals, right? Code 0, code blue, whatnot, right? So let us have that. And basically, this is a simple document, but it's not as simple as people believe it to be. But in that, the basic component would be you define what is a breach, right? You define what is a breach, what is the severity of the breach, and who should report it. Incident reporting team. I mean, someone can't send it on a WhatsApp telling, yeah, email sab kuch bahar chala gaya, right? That's not the way. So you should have a process for it. You have an emergency response team, right? In hospitals, same way you create a data breach response team. What each of them need to do, and contamination, right? How do you contain? Not contamination. How do you contain a data breach, right? If it all means that you go to your server room, switch off all the lights, disconnect, please do it. But please keep it documented so that everyone in the hospital knows about it. The other most important thing is send notifications to the relevant legal and federal authorities who are supposed to know about any data breach, right? And the other thing which is very most important is have a communication plan ready for internal, right? Internal communication plan for your patients and for external world also. Put it on social media. You have all this template ready so that one click, you know where you are. That's all I'm going to tell. Please visit our booth and go in for a security assessment.
Anyone else would like to talk about the security?
Yeah. So I think as a healthcare delivery provider, service provider, even NABH, depends on the validation or certification like Microsoft or, AWS or anything else. I think data is generated in and around patient and more so from the hospital side, right? Even if the OPD, bedside, IPD discharge or the insurance claims or anything. I think there is a possibility for, Quality Council of India through NABH to define certain standards which the Ministry of Health or NABH body owns. And then those solution providers who are working in and around patient through hospitals or through clinics, I think they need to validate and, they need to be certified. I think there is a scope to have a subset of certification specifically for the healthcare provider or healthcare consumers.
Okay. Great. Yeah, yes, sir.
Just a comment from, from seeing the operations of our hospitals. So there is a behavioral element also in this, because apart from the security systems you put in, there is a behavioral training and the attitude change which is also required. So things like, what is your password policy? What is your password sharing policy? How soon it will expire? Whether you are allowed to share patient data on emails or it has to be in a, controlled server. So these things are also important. And I have seen, I think in one of the previous panel discussions, we are more than happy to actually discuss the data. But is that correct? And of course, we are not ready, but that is where the ethics come into picture. So it is more on the individual organizations also to define the policy on patient data, whether you are discussing as we are talking about NABH and JCI, whether you are allowed to discuss it in the lifts.
Yeah.
So that is also important.
Okay. And yes, you are saying something.
So I think when we are talking about all the data security and everything, we should also focus on the data that is generated for data analytics. As we discussed that whenever we want to publish anything, and if we search for the references, we always have the references coming out not from our country. So I think with this kind of data generated, we should also focus on how we can best use the data analytics, how far we can come up with the data of our own country. And I think a very common acronym which we use at our hospital is we should maintain the data perfectly. It's like GIGO, garbage in, garbage out. So we should also focus on the type and the quality of the data generated.
Great. Briefly, Nilesh, I'll come back to you. Very briefly, if you can mention the design part we were earlier talking about. We talk about resilience of healthcare. How does that sustainable design take part of the...
I'll just hand over to him, but I'll have to leave. I have to catch my flight. I'm so sorry for leaving the panel, but the time is also up.
Okay, sure.
So when we are talking about patient safety, so patient safety starts from the, I can say from building of the hospital. Because all the fire safety we need to consider on day one. then we are talking about infection control. But when it's infection control, then we have to have a proper air handling units, proper ducting, everything we need to do or take care when we are planning a hospital. So all these things are going to happen at the time of the maybe your inception or maybe planning, that you need to look into that all these aspects. That is very, very important.
Okay, and Bhupesh, you would like to add on the sustainability and resilience part of it.
So on sustainability and resilience, I think it is very important nowadays. I think that is becoming a very prominent topic, and we need to take care of our environment as we progress in terms of expanding our needs for the thing. So to achieve sustainability primarily for the healthcare, if I may have to talk again, I think we can work in blending the energy mix of the facility, which is through various energy resources. Again, I think we cannot avoid some backup power which is required being a critical infrastructure, but there are many technologies which have evolved, primarily the microgrid storage technologies, which can offset the use of fossil fuels as much as possible. But again, I think blending of energy primarily from the green sources can help us achieve that much faster. Apart from the efficiency measures, what we embed in our ecosystem through digitization. I'll again touch on the topic of security and the data which we were talking in the previous discussion again. I think at the inception or the implementation of our digital layer, it is very, very important that we ensure that all the connected equipments or the communicating devices are fully cyber secure. I think that can be made a mandatory requirement when we are implementing those, even if it's an existing facility or a new build, whatever it is. So I think that is really important.
Okay, so I'll conclude and I'll start with the healthcare providers first. 30 seconds to each of you. When we talk about a digital hospital of the future, on your roadmap, one action, very briefly, one action which you are likely to take in the next few quarters, if I may say, starting with you. One action, briefly, 30 seconds.
I think not one, but all our actions in future will, revolve around patient and try to help the patient, be it saving patients time, be it improving quality or reducing cost. So everything will revolve in and around patient. I can't think anything else, away from patient happening in any of the domain, be it digital or the non-digital.
Thank you. I would just 3 words: clinical governance and outcome measures. That's all.
Yes.
Yeah, Narayana Health is now on the path of almost complete digital journey, is almost at completion. And we would like to see almost 0 OPDs in our hospitals.
Oh, that's great. Yes, sir.
I think automation and full digitalization, so that we can provide best of the patient experience. That will be the most important factor, and we are working on that.
Yes, Manish.
So digitization, considering that we are into healthcare and patient first.
So hospitals have already started moving outside hospitals, and we will try to be with the patient from start to end, and we will try to actually provide the services as close to their home. So that is the.
Okay. Okay. Yes.
So from my side, I'll just add one statement. I think we should strategize, digitize, and decarbonize to make healthcare more sustainable.
Okay, Dr. Anil, you have the last word.
Well, my vision is a bit different. Just to keep everyone to give out of the box thinking, right? Do you know in India, one of the biggest preventable disease burdens that we're facing is malnutrition, right? 14.6%, right? And that too, talking about it is really bad after having a good lunch, right? But even we are not left behind. High BMI, 3.6%. High cholesterol, 4.1%, right? How are we going to deal with this with 4.0 is the real question, right? I'm just going to give you one open, out of the box thinking. We have close to 100,000 ATMs which are working in India, right? Just imagine that you have a very secure HIPAA compliant room, you have an AC, you have a backup, you have internet, you have monitor, everything. Just imagine if someone comes here and converts that entire thing into healthcare ATM where you can have a teleconsultation done. Automatically, SBI with more than 23,000 ATMs across India would become the second largest after the government to have healthcare setups. Thanks a lot.
Thanks. With that, we conclude this panel discussion. And just to inform, after this panel discussion, we have a video presentation by Dr. Ratan Kelkar. He's a CEO of Kerala State Health Agency. Unfortunately, due to some unavoidable circumstances, he couldn't make it to Delhi, but so we have a video presentation from Dr. Ratan Kelkar, where he would address the audience here. Also, after the panel discussion, we will have a couple of lucky draw rounds where the audience stands to win attractive prizes. So I would now request Sanghamitra Mohanty to come and hand over a token of appreciation to each of the panelists. Yeah, Sanghamitra, if you can just come. Can we have the tokens? She is left. She has left. Or I can announce her name, Dr. D.K. Gupta. Commander Navneet Bali. Dr. Sameer Singh. Nilesh Shinde. Dr. Biren Chauhan. Saurabh Gupta. Bhupesh Arora. Dr. Anil Muniappa. I think Ekta Modi ma'am has to leave, or she isn't around. So just be there. We'll have a group photo. Please come. Announce a couple of lucky draws that we have, and I'll request all the panelists to take their seats. इसमें फिशबॉल नहीं थी? फिशबॉल नहीं थी?
फिशबॉल नहीं है, किससे निकल रहा है?
Neha, just pick up.
So I'll take the name and go
Just move it around.
move कर दिया.
Pick it up.
Okay, the first lucky draw winner is Miss Shweta from Schneider Electric. Second we have. And the second award is to Mr. Nalin Kapoor, CIO of Holy Angels Hospital. Two more awards that will be by the end of the last session. So please be seated.
I'd request Shobhi to now come and. Oh, yeah, we have the Dr. Ratan Kelkar video now. Can we have video played? And after that, Shobhi.
Hi, good morning, everyone. At the outset, let me congratulate APAC for arranging a wonderful for all of you. And I hope that the deliberation that is going to happen today would be very useful. And based on that, the insights which are going to come, we'll be more than happy to look at that and take forward any of the directions which come out of the meeting. Kerala, as you are aware, recently we have declared the state of Kerala as a completely e-governed state. The reason being all the departments are giving electronic services, and we have a very good core infrastructure in terms of the IT. When I mean core infrastructure, it means the data center that we have is, we have 2 data centers already, and we are in the expansion phase of the second one, and we are looking at another new data center which is coming up along with the DR facility. And from the data center, the connect to all the offices. Earlier, we used to have something called the Kerala State Wide Area Network, the K-SWAN. In addition to it, the state has its own dedicated internet service provider in the form of K-Phone, wherein we are looking at connecting each and every office, each and every person with internet. And internet has been declared as a basic right for all the citizens of the state. And the last mile services are given through our Akshaya centers, which are the common service centers which we have in the state. So the state is completely geared up for giving all the electronic services, and the IT ecosystem is also facilitated by some of the organizations like the Digital Kerala University, which is a very unique university for the digital space. The Startup Mission is also very active in Kerala, and the startup community is vibrant, which also helps us to deliver services of all departments, including health. And for building capacity amongst the staff of the department and also amongst the public, the ICT Academy is an exclusive space which provides the capacity building as well. Now, coming to the health care delivery per se, Kerala has been at the forefront of delivering healthcare using IT as a tool for assisting all our health personnel. The electronic health record in the form of e-health project has been implemented to more than 60% of all the public health facilities. And Kerala also has a significant number of private health facilities, and they are completely digitized. And we are looking at a mechanism to integrate, the public and the private healthcare for our continuum of care and forward and backward linkages under the Prime Minister Jan Arogya Yojana scheme as well. Now, the electronic health record here is also integrated with the digital health mission of Government of India, and to that extent there is a conformity for the data sharing and data management. The capacity building is improved amongst all the health staff through our learning management system that we have, which gives training to all the health staff in the public as well as who is interested in the private sector using a LMS module that we have. The drug management, as is done across the country, is also completely on electronic platform in the state, and we are looking at the data very closely. What is generally missing with the states is monitoring and evaluation wing, and through the National Health Mission, there is a monitoring and evaluation wing exclusively for the health department, which looks at data from important programs and takes corrective course corrections in that particular scheme based on the reality from the field. Now, there are multiple other initiatives which has been taken in the state in terms of implementation of telehealth through the eSanjeevani, which is a Government of India platform, and also the teleradiology in many of the institutions. So there are many innovations which are being happening in the which are undertaken in the health department using the startup community in a big way. Since we have a very vibrant startup community, we use their services for delivering services in the departments, including health as well. So that is what we have been doing currently. But going forward, the next gen technologies is what we are very keenly looking at. The artificial intelligence and machine learning is one which we are looking at using in the disease diagnosis, the management of the patient, as well as the image processing. I think we'll be having pilots also being started in multiple health facilities on this aspect. The remote ICU and patient monitoring is also a thing which we are looking at implementing in the public sphere. This is already there in the private hospitals. So we are looking at doing this as well in the public hospitals for patients who are unable to travel to our district hospitals or the center of excellences, and we are looking at managing them remotely. The blockchain, we feel, would be another technology which will be very useful for management of records, especially when we have complete e-health records with us. The augmented reality and virtual reality is another important initiative, or rather a technology which we will be looking at very closely, because the state has many medical colleges, and teaching using AR, VR would be something which will be very beneficial for the students. And IoT device utilization is another activity which we are looking at using in our health facilities, so that we can monitor and manage the patients more efficiently. And there are many other technologies like the nanotechnology, which can also be used in a big way. The robotics we have started using through our startup called Gen Robotics, who has developed a robot which will assist in physiotherapy for patients with paralysis. And we are also, as a stream of education, bioinformatics is one which we are looking at focusing very keenly, because the management of the data and analysis and feedback is one which is very important. So bioinformatics would definitely be another technology in the coming days, which the health department in Kerala will be very keenly looking at. So there are many opportunities for the health department, and generally what we have found is the embracing of technology by the health departments across the country is not in phase with which the technology keeps changing. For example, the use of 5G has not yet been extensively done in many of the states. So 5G is another thing which we'll be using which will be using much in the coming days. And the state also has its 5G leadership package, which has been declared by the Honorable CM for uptake of the 5G technology. And there are many use cases of using 5G in health, which we'll be using in the coming days. So there are, technology is already there. How do we embrace technology? How fast do we make use of this technology for the benefit of all the departments, including health, is one which we need to look at very closely, and also we need to expedite our actions of embracing technology so that we can make the best of technology for the benefit of the people. Now, technological advances have always been there, but how do we use that for our day-to-day life? How do we bring it in our standard operating procedures? How do we bring it in our patient management? I think that is a challenge which we need to overcome. And for that, I think there is a requirement of kind of a change in the mindset in terms of acceptability of technology in health, which has already happened in elsewhere. Now, radio diagnosis is one area where most of the actions are now happening using an AI ML tool across many countries, whereas the uptake of that is not so much in India. I think these are some of the changes which needs to come, and I'm sure that the changes would happen at a very fast pace. And I hope that the deliberations which are going to happen today in this conference would also give us insights into what best can be done in terms of embracing technology and expediting actions on technology for the use of the common man.
That was Dr. Ratat Kelkar, Chief Executive Officer of State Health Agency, Government of Kerala. Always a pleasure listening to him. He has said a lot of things. He talked about how they're looking at next-gen technologies like blockchain, AI, and other things. But at the same time, he pointed out a very important part, especially for government perspective, that the way technology is changing fast, but whether the state governments or governments are ready to embrace that kind of technology, whether government is ready to those kind of changes. So that is very important what he has said. Thank you so much for that. So we have come to the last leg of this APAC National Health Tech Innovation Conclave, perhaps the last session, but very important session. It will be a panel discussion on digital upskilling, health workforce for the digital future. We heard in the inaugural session, a lot of speakers talked about what about managing human resources. And to manage human resources, the need of the hour is whether our human resources are skilled enough or upskilling is happening to the needs of the hour. So this session will obviously discuss about that. For that, I would like to invite eminent speakers from the hospital chains, but also there'll be an industry presentation before the panel discussion starts. So I'll first invite the moderator of this panel discussion, Dr. Kausar Shah, Senior Vice President, Max Healthcare, to come on stage, please. A huge round of applause for him. Dr. Ashish Chaudhary, Managing Director, Akash Healthcare Private Limited. Dr. V.R. Gupta, Group Medical Director, Sarvodaya Healthcare. Yes. Dr. Karan Thakur, Group Lead Sustainability and ESG and Vice President, Indraprastha Apollo Hospitals. Dr. Karan Thakur. Dr. Ashish Shukla, Vice President, Operations and Strategy, Regency Healthcare. Let me invite Colonel Binu Sharma, Senior Director, Nursing, Max Healthcare. Colonel Binu Sharma is here? Okay. Welcome you, ma'am. Let me invite Kavaljit Oberoi, Group Chief Nursing Officer, Paras Health. Let me also invite Captain Sandhya Shankar, Corporate Chief of Nursing, Fortis Healthcare. Is she here? We welcome you. We're also joined by Dr. Ashutosh Srivastava, Medical Director, Aditya Birla Memorial Hospital. Dr. Ashutosh Srivastava. Yes. And we're also joined by Rahul Datta, Chief Operating Officer, Fernandez Hospitals, units of Fernandez Foundation. Mr. Rahul Datta, is he here? Rahul Datta. And now, as I've said already, that before we start the panel discussion, we'll have a presentation by Selva Kumar Devanan, Founder and Managing Director, Climate Solutions. So I request Mr. Selva Kumar Devanan to all come on stage, please. A huge round of applause for him. So over to you, moderator Dr. Kausar Shah. Before you start the panel, we'll have a presentation, then the session is... It's up to you. Okay. We'll have the presentation? Yeah, sure.
Yeah, good evening, everyone. Actually, we are the largest biomedical equipment maintenance and management company in the country. We are about 2 decades of experience managing about 150,000 equipments, from small to high-end equipment like CT scans, MRI scans, in India, Malaysia, Philippines, in Middle East countries, and as well as in African countries. Our maintenance management protocols are designed in strict compliance with the NABL, AERB, ECRI. ECRI is Emergency Care Research Institute, which has been a non-profit organization. We'll be giving the guidance about the maintenance and the preventive maintenance protocols and other things. Whereas ASHI is an American Safety in Healthcare Engineering. Here, actually, we are the only company accredited by NABL for about 103 parameters, which covers the entire range of biomedical equipment. And we have a state-of-the-art enabled calibration lab in Hyderabad, where we will be having the capability of providing the calibrations for all range of equipments, from a simple BP set to quality assurance of CT scans, MRI scans, like digital X-ray, like that. Then we do have a AERB certification program, which will ensure that radiology equipments, again X-ray, and certifying the radiation safety, leakage radiations, and other things. Then we do have a ISO 13485, which is pertaining to medical devices, only for medical devices, where we will talk about the safety in the sense of electrical safety, patient safety, and risk management. Then another, of course, we have a normal ISO 9001 as well. And so these are the standards which we will be using. IEC, which is for a medical device electrical safety. Normally, if you see in India, it is estimated some that we have about closer to more than 30 million equipments in the private and public together. Out of this, only 3% of the equipment has been carried out these days. Normally, this is supposed to go through every year, or some of the equipments, critical equipments, it goes to twice a year or 4 times a year, but only 3% of the equipment has this kind of test has been done. And again, the maintenance protocols, preventive maintenance, regular calibrations, performance check, which is also taking place. Then, so what is biomedical? What we are supposed to do, need of drafting, finalizing the specification for the new equipment, and commissioning and installation. Then we do the corrective maintenance, then quality assurance test, then training, application training and clinical application trainings, then also condemnation actually. It's a total complete equipment life cycle. So here you can see the graph from 2016. So this is the USD in billion, which is the Indian industry, where 2016 they estimated 3.96 billion, whereas it estimated in 2028, which is about 9.2 billion. Out of this, we have a various category where some equipments has been managed by the manufacturers or the suppliers. Whereas you can see the red mark. Red mark is a very high, which is about more than 50% of the equipment, which is covered the equipments which is related to the patient monitoring system, ECGs, electrosurgical, there is cautery machines. So that kind of machines, which is 60%, which is supposed to be managed by the local biomedical engineer in the hospital or a service provider who is able to provide the services, is not taking place in the country. Which is normally now, actually the biomedical come into India very effectively. Government of India start looking into this in 2014. That time there was a survey as conducted by NHSRC under Ministry of Health and Family Welfare. There are about 45% of the equipment in the government sector was non-functional, due to various reasons. So they come to the PPP, private-public partnership mode, and start giving the equipment to the third-party service providers. Now today, almost this program is successfully running about almost 18 states, and overall now they are maintaining the up to about 98% in overall.
On so the previous slide, I was seeing the entire thing.
Yeah.
If you can just go back to that.
Yeah.
Just a small question. Yeah. Why the plastic is so stagnant at the same level?
So this is the category is a very small category. Mostly these equipments are used in the operation theaters, and it has been done. Most of the service has been done by the service provider only. So normally third-party service providers normally they don't do that kind of services. Whereas the red marks the one where the biomedical engineering department in the hospital will be normally carried out providing it. So we come to the again software-based management system where we can able to come with the centrally help desk operation with one call, one contract, and one project, something like that. Every state we have one toll-free number. So as soon as you log the complaint, automatically the engineer will be attending the call, and the engineers throw out his service, where he is located. He's tracking, and he can able to raise the spare parts requirement, everything online, and he can able to track what is the progress of the repair services, or what is the schedule doing the preventive maintenance or calibrations. See, if we talk about calibrations, again it's the same story. Only 3 to 4% of the equipment in the country has been calibrated as ever NABL. Remaining 96%, normally nobody does the calibrations. Even there are hospitals which is NABH accredited hospital, still the calibration is not done properly as required. And so we come to the this solution for this by having a real-time dashboard, so that you can able to track all the activities of maintenance, including preventive maintenance, calibrations, even whether calibration is done, or what is the variation during the calibration, then inter-laboratory comparisons, all will be the information will be available in the system. So these are the just test equipments which we will be using. And this is a dashboard. Suppose one of the state, like a government of Jammu Kashmir, where we are providing the services, where almost close to about 31,000 equipments. And what is the status? Everything is available here. It's a real time. How much equipment condemnation has been done? How much has been proposed, approved? What is the actual uptime here? You can see 98.87%. We are currently maintaining it. And you can see what is the critical equipment. The critical equipment, how much is the non-functional in that? So everything will be available. And in addition to this, now we are coming out with the one AI-enabled TechBot Biomed software, which we are already testing going on right now in a few of the state. So that one enable the engineer to troubleshoot the equipment in a real time by having backend support. That means when he have a doubt, even the system will, based on the doubt what he raises, the system will tell him what to do there. So the library we built up for about 480 equipments category, we already built the library. So now that is what's going on. In addition to this, actually we tied up with now there is a Quality Council of India comes out with the concept of certifying the biomedical engineers. That means we can, we can say everybody, as soon as they completed a demo or degree, they are coming as a biomedical engineer without any training to the industry. So now Quality Council of India has advised AMTZ in Vizag. This is one of the Andhra Pradesh medtech zone. They comes out with the program called engineer certifications. So all the engineers in India in future will be undergoing a training with them, and they will be having a certification for providing all these services. So we signed MOU about 15 days before with them to certify all our engineers, those who are working across India. The program has been started. Hopefully, this will we'll be moving on to other.
TriMade was founded in 2012. We passionately aim to deliver healthcare technology management services. We provide top-notch service support to healthcare facilities with minimal interruptions. We aim to provide high-quality, effective biomedical equipment maintenance services to the healthcare industry through our highly experienced, globally recognized team. One contract, one cost, one call. We are certified ISO 9001, ISO 13485, ISO 17025. What we do? We provide medical equipment maintenance, repair and calibration services. All types of healthcare facilities which are equipped with biomedical equipments. Establishing excellent business relationship with our clients. Our vision. Our business is to provide cost-effective biomedical engineering maintenance services to the healthcare industry. Our mission. Our objective is to be the industry leader in this field and meet customer requirements all the time at par with global standards. Experts in clinical biomedical engineering services. Over 500 trained biomedical engineers work round the clock and cater to the issues in various parts of India, from Jammu to Kanyakumari and Rajasthan to Manipur in various local languages. Hospitals are the primary focus of health-related aspects. ranging from health issues, operations, checkups, consultants, and treatment. 24/7 customer care center. Using TMIS to plan and control. Maintenance information system, cloud-based. Our accreditations and certifications. Our company in India has been certified for 103 parameters by NABL. Received NABL accreditation in 2020. Calibration services of medical equipment as per global standards. Our state-of-the-art, world-class PC repair lab is run by expert technicians proficient in the latest medical tools and techniques. Our department hires only highly qualified specialists for its staff, like biomedical engineers, quality system managers, trained in the latest tools, equipment, and techniques. Our key success is innovative solutions with technology advancements, ethical practices, and our global experiences. Established in the year 2012. Moved to corporate office in Hyderabad, 2014. Awarded biomedical equipment maintenance for Mizoram State in 2015. Awarded biomedical equipment for Tripura State in 2016. Awarded biomedical equipment maintenance for Jharkhand and Arunachal Pradesh states in 2017. Awarded biomedical equipment maintenance for Chhattisgarh in 2018. Working with MCGM Mumbai in 2019. Awarded biomedical equipment maintenance for Jammu and Kashmir state in 2020. In the year of 2021 and 2022, Tripura, Mizoram and Arunachal Pradesh projects has been renewed. Our CEO has been awarded the 20 most inspiring CEOs by Innovative Zone. Our company Triumph Solutions has been awarded the top 50 healthcare companies by IFH. Awarded as Best Biomedical Equipment and Management Services in 2019. Awarded by Department of Biomedical Engineering, Osmania University, Meditech 2018. We have signed MOU with AMTZ Vishakhapatnam with collaboration of ISBC, which is certified by QCI. Our engineers are IBSC and QCI certified. Our innovative TechBuck Biomed software is AI-enabled and service management system facilitates our field engineers to troubleshoot the equipment problem to maximize the uptime and lifespan. Our dashboard and MIS reports. Uptime and allowable downtime of equipment.
Thank you. Thank you so much.
Thank you, Selva Kumar Devanan, founder and managing director of Triumph Solutions. May I request Dr. Kausar Shah to hand over a small token of appreciation to Mr. Selva Kumar Devanan. Big round of applause for Selva Kumar Devanan, founder and managing director of Triumph Solutions. And with this, I hand over the session to Dr. Kausar Shah, Senior Vice President, Max Healthcare, for the panel on digital upskilling health workforce for the digital future. Over to you, sir.
Thank you so much, and a warm good evening to everybody. But my two questions to the organizers first, not the questions, just two lines basically. The first line, thanks for allowing us to be here. But the second line is even more important. How much time do we have? 40 to 50 minutes. Okay, because accordingly we'll basically position ourselves. Okay, fine. So guys, आप लोगों में से भूत किसने देखा है? Anybody who has ever witnessed a ghost? I'm not talking about myself. Don't look at me like this, please. Nobody? I'll give a small story about this. So many years back, there was a new hospital coming up in Gurgaon. It was in the construction phase that time. I was pretty new to the management that particular time. I had just shifted from clinical to the management. I got an opportunity from there and just trying to explore something which was coming up new. Without understanding what is the profile, what is the detail, what is the organization, I just jumped into it. वहां जाके मैंने भूत देखा. Hospital was supposed to be, it was in construction phase, it was supposed to be a different type of a hospital, and I realized this much later after getting into it. वहां जाके मुझे पता चला this hospital is going to be a paperless hospital. Being a doctor myself, we have never been taught about what is IT, what is computer, and what is computerization. When I saw my table, which was basically it was a desk which was given to me, it had a huge something like this lying there. I was told this is computer. This is the only thing you will be working upon. There is no paper here. When I looked at it, I actually felt like I am looking into a ghost. And that ghost was all over the organization. Everywhere it was paperless organization. I don't want to name it basically. But the point is, I really used to be feeling मैं भूतों के बीच में चल रहा हूँ. I had no knowledge about the computerization. But then of course I had to take it up because I was into it. So I had to take it up. I started doing some classes and all. I picked it up. So if I share this with anybody today, nobody will believe this because I've completely shifted from that to being a tech savvy or whatever you want to call it. I don't believe in paperwork anywhere. I just believe in soft copies. But till that particular time, I had no knowledge what is a hard copy. I had no knowledge what is a soft copy. On that particular day, if I look at this today, imagine we are talking about digitalization today. Digitalization is many steps ahead of what I experienced many years back. Now, when we look at the digitalization in healthcare, actually, if you see, it's very gorgeous. Not just that, it's actually very seductive for every C-suite person. All the CEOs, and everybody is basically bowled over by this. They want to have it. And everybody has been trying to have it. They all have been grabbing it for the last many years. I mean, every organization is trying to run after it. But the point here is, and I think that's the reason why we all are standing or seated here, the utilization of digitalization is not even 35 to 40% in any of the organization as of today. The point which I want to make from here is like, despite having digitalization transformation in so many organizations, the real ROI is yet to be achieved. There is a huge cost to it. And when I look at from the P&L perspective or from the finances perspective, it actually pinches. But the point which I again want to say here is the ROI is very much there. But the point is that we are not able to achieve it. The biggest challenge that we face in achieving it is nothing else but the marriage of the technology and the sources which are doing it. And that's why we are standing here. That's why we are seated here. We have I think one of the most powerful panel towards the end. Probably it is to hold you guys back and your attention as well. And I think we are definitely going to do this. So that's what the challenge is. How do we do this? That transition from a stage where most of us who are still into the healthcare, maybe bearing the latest people who are coming into the healthcare sector. So most of us who are standing or seated here are not or have not been taught about IT or digitalization in our college days. But we had to transition. But we are just about 2 to 5% in any organization. Rest of the entire organization is still lying the same way. That's why the ROI is still not achieved, but it is available. It's available in the systems itself. So just trying to understand that challenge, how we can shorten this challenge, how we can shorten this distance. We all are here, and I would actually like to throw the first question to Dr. Ashish Chaudhary, our speaker here. Like, in terms of key digital skills and competencies in healthcare, what are the key challenges that I believe if you can make all of us understand from professional perspective that the professionals face because of which they are not able to transition into it?
Thank you, Dr. Kauser, for kickstarting the session, giving the context of this current panel. Having said that, I have got, myself also transitioned from somebody who was writing paper prescriptions for 20 odd years. And then I was forced to, transform myself, get onto the EMR and start ordering onto the system and devote 80% of my OPD consult time on looking at the system rather than the patient and answering to the patient while typing simultaneously. So that transformation was quite difficult for any clinician, just like me. In fact, that was forced upon me because nobody else would follow unless I will follow. So every clinician I found that had a huge amount of resistance in that kind of change. All this last 7-8 years, we have been trying to get on board one and the other consultants from various specialties onto the digital. And now especially after the COVID, when they realize they are not able to interact with the patient one-on-one, and they're able to carry out the COVID treatment either through giving teleconsults online or trying to put the orders on the EMR application and the order getting executed far distance, even while they are in quarantine or they are sitting at home or they are traveling. So that was some area where they found some utilization or some merit in getting transformed digitally. So that actually brings to the point that healthcare, there are two parts. One is management, which Dr. Kauser just mentioned. The management is all after digitization, but do they really go to every consultant and ask, whether they are comfortable in that? Definitely, the first answer will be no. We are happy the way we are going. New age, Gen Z doctors, if you see surgeons, they are happy using the apps. But if you talk about senior consultants, who are the actual business drivers, you can't force them to, get onto the system unless you sit with them, look at the merits of the system and also the advantages they can have in the patient care. So anything which brings about improvement in their surgical care, medical care, bring about improvement in the patient experience, and patient comes back and reports that, yes, the system has helped me, even follow the advice while you are busy in the OT. So these are the few advantages or the merits which a senior clinician can get. So that kind of connection or the marriage, you can say, the management and the clinical team or the core team has to make so that everybody gets on board. Even now, most of the EMRs we have in market, nothing is perfect. Only thing is you have to adapt to the EMR or change your process to fit into a particular type of EMR, and it is evolving by the day. Yes, we can't compare our systems, our patient education level with the Western world. They are far ahead in technology. But if you talk about Indian doctors or Indian healthcare system, with that much of OPD load and that much of patient influx in the hospital per day, I think we do a fantastically better job as compared to our Western counterpart in terms of even diagnosing a disease in 3 minutes or even with the gait of the patient walking inside an experienced surgeon. So those are the areas which nobody else can match. But if we add on a technology part, if we add on some real merit and advantage of adopting digitization, I think that's the key which every healthcare institution should focus upon. As a manager, I would want everybody to use the entire EMR, but that's not the reality. Even if I look at my own system, 30-40% is the total EMR which is being used by clinicians. But even then, it brings about a lot of change. So I think the crux is that one should keep on evolving every day. One should keep on going back to the consultant, looking at their problems, and the IT team can help with the management and sit with the doctors and find improvisation and solutions for improving the patient care. So a lot of things are in the market, whether it is IoTs or telemedicine, teleradiology, everything has got some advantages. But yes, you have to look at the clinical significance, improvement in patient care. If that is the end result, I think ROI is definitely going to come, but it will take some more time.
Thank you so much. And I think, this is a classical example of leading by example, what Dr. Ashish just said. Now, He being a clinician himself, he being the head of the organization, since he's doing it 100%, the implementation in the organization is much huge. But at the same time, he just mentioned that it is about 40%. Now imagine a place which is not being headed by a person who is so tech savvy, so pro to it. What would be the condition of that particular place? That's exactly what the challenge is. So the next thing which I want to ask is to maybe Captain Sandhya, you can just flex your muscles. It's coming to you. So you know what? One way can be that, as Dr. Ashish just said, he has to lead by example, keep training, retraining people. But the other way, and this is the organization which he's heading and leading himself, that's why it is there. But many other ways it can be an organization which wants it to be tech savvy, but they don't want to do this he's doing. They just want to boom, 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 keep throwing all the things on the people who are working. You need to do this, you need to do this, you need to do this. May or may not happen. Now, my question is to Captain Sandhya. What would an organization do in such a scenario where they want everybody to be tech savvy, want to be working on the digitalization, or system you can develop where everybody becomes pro to it and the organization gets the benefit?
Thank you, Dr. Kausar. Probably, laying hands deeply on day in and day out on operations. I want to thank you for asking this question from me. And two things, which flashed to the mind, and a message to all the administrators and the organization owners and the implementation heads is launch, roll out to trust your people, not to control. This is the first point. Second is build constellations, not the stars. Now, having said this, and this is loud enough when we want the ground people or the frontliners to be aligned with a vision or the project or the ultimate aim the organization has envisioned. We fail, we collapse when everybody in the chain is not aligned that yes, EMR has to be rolled out, up and sailing and rocking in the organization. Starting from a staff nurse or a technician till my head of department is seeing the same form, same template, and using the same information, where is it passing through multiple screens and translates into a prescription or a summary, gets handed over to the patient. How do we do it? We train. So training certainly helps, but where is the attitude? So along with the training, before everything, when we plan, we are dreaming a project, we are conceptualizing a project, the planning and the budgets are the thing which goes at the forefront. Now, while we plan and we budget, involving the people from the front line have to be there critically, when the critical decisions are being made. So this is now number one. First is with trust and respect, involving people from every cadre who is going to contribute to the patient journey directly or indirectly, be it from biomedical engineering or the nursing or the administration or the process owners, so on and so forth. Second important thing is cascading the goal and the vision to everybody way before the final launch. This is the second thing which is important, because sensitization towards the goal is, it makes the people aware and aligned to the intent. Third important thing is working on the infrastructure and creating mock rooms or, for the drills, for the people to get used to and people to have sensitivity towards what is coming in for me. Fourth one is rewarding and recognition and probably communicating in a better way on small wins. And there goes the master trainers, along with this, the champions. Now, this process is known to everybody. Probably everybody who's sitting in this hall or outside embarking on these journeys and digitization plans. Thing is, how do we implement it and how do we make it happen? And how do we sustain the traction throughout when the confident user is there to make my vision and make my intent happen? So this is what probably, it's not a management jargon, it's experience, it's intent and attitude when we don't want to lose the traction. Of course, keep collaborating with the teams, not in silos, and moving on. So That's all I say.
Thank you so much, pretty well said. And just a small question to what you just said. What could be the right approach for the organizations when they're selecting a person? Should that be at the time of selection, that they should be only selecting tech-savvy people, or it should be an approach where the people are there, taken into the system, and then there is a constant training going for that?
Not necessarily. You don't have to hire tech-savvy people. It's the attitude which matters. You just said that. You were at ground zero. Today you don't, accept
But I had to face a
everything.
ghost.
Yes.
मुझे
You have
भूत
to
का
face-
सामना करना पड़ा.
Yes, that's what was the attitude which brought you here, right? I won't say we can assess the attitude, we can build attitude. And there comes the collaboration, because collaboration, trust, belief. And I said purposely, build constellation, not a star. So
Thank you.
bring
You
it.
appreciated
Thank
me, so I'm dropping the question here. Thank you. थोड़ा हंस लो यार. So guys, I know, I can understand. That's why I'm trying to give them more laughter actually. So the next question is for you only, Conclave, because you spoke in between. So the question is, what can be the potential benefits for three components in terms of healthcare? One is the employees, the people who are the professionals who are into the healthcare organization. Second is the patients. The potential advantages for digitalization from the professional's perspective, from the patient's perspective, and the third is from the overall organization's perspective. Can you just put some light on that?
Thank you, Dr. Kausar. Interesting question. And there are multifold benefits. I think let me just start listing for the organization first. The organization leadership is very passionate. They want to implement the entire digitalization in the new hospital or existing hospitals. They have dreams. They want to showcase the digital capabilities of the organization. They invest in huge budgets for IT. They hire a big IT team. In fact, the budgets sometimes get compromised with the manpower budgets and the biomedical equipment budgets, because the IT budgets we just heard are always, I think, the highest among all the budget planning. The organization has a lot of benefits. First of all, it is efficiency of processes, efficiency of billing and charging, transparency for all stakeholders, including doctors, other professionals, including patients. In fact, their reach to the public or communities is much higher. Their PR programs, the promotions, the immunization program, the marketing, everything gets a smooth journey. Data management, transparency, medico-legal aspects are handled better. Data storage, where they have to store huge files in olden times and pick up rooms within the hospital or warehouses, etc. Now it is all on the digital. So a lot of benefits. Also patient safety, infection control practices, the websites they have where they can have all the promotions for doctors, availability of information to the patients. All of this are huge benefits for the organization. It also helps the quality team in the hospital for managing the incidents through a real-time reporting, real-time analysis, no hiding of incidents, and also for other managers. Apart from the authorities, biomedical engineer, interfacing of biomedical equipments with the patient monitors, whether it is infusion pump or ventilators or anything else, the data is straight away available and you can't change or fudge the data. That's part one. The housekeeping gets huge benefit through digitalization, where the room status, the room vacant rooms, availability of rooms, taking on admissions, discharge management, all of these processes get quite streamlined. The benefits are huge for the medical heads and the nursing heads. Huge benefits for the biomedical engineers, facility engineers, where BMS, temperature, humidity, everything is a click of the button. So the benefits are enormous for the organization. If I talk about the patients, I think in our country that has evolved in last few years. The patients are able to use the digital platforms. Of course, there is a absolute outflow of n number of apps, health apps, information, various platforms. But we know in our country, out of the 140 crore population, almost everybody starting with the 3 years old can access a WhatsApp, a mobile, the Facebook, the Instagram, and that's the easiest adoption we have seen, including our Sabziwala, the milkman. Everybody can use a platform. So for the patient, there are benefits of availability of data. They're reaching out to the hospitals for scheduling consultations, scheduling appointments. During the COVID, we have seen a greater use of telemedicine, which was launched years ago, more than 2 decades ago, but was not used much. So for patients, that is a benefit, access to report, taking consult through WhatsApp, through other platforms created by hospital, and having cross referrals. Also, the patients can see transparency of information on the reports. There are patient apps, there are doctor apps. The orders are straight away available to the patients. So these are benefits for patients, and patients are also benefited by remote wearable devices, remote monitoring, home health care where a patient is at home for a ICU. The doctor, the nurses, they can manage him remotely through the camera devices, etc. The records are available. Patient gets a huge benefit. Coming to the healthcare professionals, I think there are a lot of wins for them, but the success story lies if they understand what is in for them, especially our clinician friends, those who are from 20, 30 years experience and more. They are highly competent, they are very busy, they've got workload of patients. They feel this is another burden or another ghost, as just mentioned by you. I used to visit a couple of hospitals. I worked in 2 corporates, Max Healthcare and Columbia Asia. And Columbia Asia was known as a paperless organization. We opened hospitals in tier 2 cities, smaller cities, Ahmedabad, Patiala, so on and so forth. When I used to ask the doctors, what help do you need? The only help they wanted was stop this computer business. They said, why can't we write on paper? For 20, 30 years, I have written on paper. Probably they were not consulted. Their buy-in was not taken when the digitalization journey began. So if you want a success, it's highly beneficial to doctors. They have their data available and they have an app available. They can prescribe sitting anywhere. They can send advice. They can order investigations. They can see report. They can see trends of reports. They can see their own performance scorecard, clinical outcome. Huge benefit. They don't have to go through a pile of files for patient record. The EHR is so efficient if well done. If well done, to be quoted. The IT teams which are creating these platforms in the hospitals, especially for clinical usage, have to think in mind efficiency and simplicity, not making it complex for clinical teams. In our country, we are already hard-pressed, shortages of manpower, doctors, nurses, our paramedics. Hence, it has to be simple, promoting efficiency by simple platforms which are easy to adopt, easy to understand, and their onboarding is done properly. There are huge benefits for doctors. For nurses, it is, I think, a fantastic platform. In both the organization where I worked for about 20 plus years, we have had seamless, paperless, digital platforms for nurses. They have found it extremely useful. The younger population, which is coming now straight from the colleges, adopt it in a jiffy. They need all about 2 to 4 weeks time to adopt the hospital HIS and all other platforms. It is also beneficial when you wish to train your doctors and nurses. There are learning management systems. There are online systems, and there are virtual simulation labs. People are coming without hands-on training from colleges, whether medical or nurses. Thanks to COVID, this still went down. So if you wish to train a person on a specific skill, procedure, surgery protocol, or process, you got virtual simulations. That's part of a fantastic digitalization when you wish to train people. I would say there are benefits for every single person in the healthcare system. Even a housekeeping staff who's an outsource has a tracking system, a porter tracking. We use RFIDs. You can track where equipment is moving, where people are moving, whom do you want to reach out, patients in the OT. Real-time updates can be sent out to the patients, the family members, and to the healthcare professionals. Where is the patient? On the operating table, in the pre-op area, has finished surgery, or it's going to take time, mass SMSs. I think I can go on for days and hours. I wish to stop here. There are huge benefits for every single person. You can take it in inverted commas. The system has to be designed well for adoption, not for complicating lives of people in the hospital. Thank you.
Thanks, Bino. You know what? Through my artificial intelligence, I was making it out from Dr. Vibhu that he's about to raise his hand. He wants to speak something.
All right.
I just read through my artificial intelligence. You know, it works. So, Dr. Vibhu, the question is for you now. Basically, I just wanted to understand. She spoke about the entire advantage for the people.
Yeah.
Every hospital has got two main factors. One is the patient outcome. Second is the quality. In terms of the advancement of the technologies getting into the healthcare sector, what benefit do you believe can occur at these two places in terms of the healthcare?
Yeah. So, first of all, Madam Binu Sharma has already raised so many benefits. But as we started using this technology from the time of COVID, what we have seen, it was a path breaker. I mean, how the reports came fast, and even after vaccination, we have seen how fast we were getting all those things. And after getting the benefits of all digital medias, whether like doctors, we are famous for their smart handwriting. So with use of EMR and all those things, instances of medication error, even better infection rates, so many outcomes, they have become better. I'm proud to be sitting with the next to orthopedic surgeon. So like use of robotics, how it has changed. Like in my hospital, we bought that robotics, which was the first, I'm not doing any marketing for that, but just that particular robot, it has got the particular facility that it will not cut posterior cruciate ligament during the surgery. It will retain that. So what I have seen in last 15 months, we have done more than 1,500 surgeries, and how patient is going after third and fourth day. Patient are made to walk on the day of surgery in the evening, and after 4 days, patients are discharged. So that's a very good clinical outcomes what we can think of with the help of technologies. And of course, I also want to thank India government, like what we have done for even this ABHA card. Although we have got a lot of population, but still so many crores of this health record for Ayushman Bharat health account, they have been created. So in the future, that will be like everyone in the hospital, they will just come without any paper. So as you mentioned very nicely about the story of ghost. So it's a very good thing, better clinical outcome, better average length of stay, better infection rates. And that's why a lot of emphasis is given to digital era. And I'm very happy to say that even the government of India, like the budget, what they are keeping it for, it is 4 to 5 folds. If you see annual, their growth rate based on that, but budget they are keeping, it will be around 24 to 25%. So that's the very important thing, how things are going to help in technology, in better clinical outcomes, and naturally that will help for better patient satisfaction.
Thank you so much. I think pretty well said. And I know Karan is sitting and itching to speak about something. So here comes your turn. So we spoke, we just heard so many things from so many people Now we have heard from only from one side. Now I would like to come to you with a different type of a story. Like if we need to be at the level of healthcare professionals, what challenges or what shortcomings they may face with this upskilling into digitalization?
Yeah, I think that's a very important question, and a lot of the benefits have been covered, both the systemic benefits and benefits to patients and staff. Dr. Ashish covered some of the challenges that clinicians face. A lot of one feels at the systemic level has to do with a lack of integration. There are different types of technologies. When we talk about the system, actually there is no the system. There are many systems which are trying to interact with each other. Your MRI software is very different, which a technician may know of. It's very different from your HIS, very different from your billing. There is a level of integration that has happened and some bolt-on which is happening on existing software to make it more interoperable, but that remains a challenge. When we speak to clinicians, we often hear from them that, look, you're sitting in silos. I may do this bit, but connect me to the IP, or doesn't connect me to the MRI, or doesn't connect me to the clinics outside. And more recently, we've heard it doesn't connect me to your telemedicine HIS. I think those gaps exist, and I think we as healthcare administrators need to look at those very specifically to plug. Also, the interoperability between systems varies when we are looking at international patients, and a lot of hospitals in Delhi and the metros get patients from overseas, and we may be keen to push EMR to them and offering them this as a differentiator. But when they go back to their own countries, they might have challenges accessing that data or with continuity of care. And third challenge remains that doctors are expected to be available all the time, 24/7. So if they are sitting at home, the easy way to get a report to them is through WhatsApp or through other systems. Very difficult to get them to go onto their systems, open that system and access it so that there is data patency. And one can appreciate where they are coming from. This whole 24/7 availability is a challenge for them. But I think as administrators, we need to be mindful of the challenge that our workforce faces in the adoption. And the other differentiation that I want to bring out is that we are talking about digital upskilling. One is to upskill ourselves using digital tools, and the other is to upskill ourselves about digital tools themselves. And there again, I think we need different types of approaches for different people. If it's a housekeeper, they have different digital needs. If it is a senior surgeon, he or she has different needs. And if it's the reception staff or patient-facing staff, they have different needs. Till the time we try to have a one-size-fits-all, we will continue to face these challenges. And I think it's a work in progress, but remarkable progress has already been made, accelerated during COVID. And in the years ahead, there is now a conducive regulatory environment to push people to adopt. The good part is digitalization was a differentiator for hospitals. They used to talk about it. Today, it's the norm. It just shows the road that we are on.
Thank you so much. I think pretty well said. So this brings me to Mr. Ashish Shukla. Like the challenges which he just spoke about, what do you think could be the solutions for it? If there could be any specific suggestion from your side, how this can be resolved for the people who are the users?
Thank you for...
You're audible.
Thank you for giving me this opportunity. We are here to discuss this digital upskilling. So I would like to say, like, according to some World Economic Forum reports, it says like in next 3 to 4 years, like around 30 to 40% people would be requiring some kind of upskilling or reskilling in their domain areas. So as Dr. Karan rightly said, it's a new normal, you can say. You need to upskill and you need to hone the skills, digital skills, as far as the clinicians are concerned, paramedicals are concerned, nursing staff are concerned. And also WHO says involve everyone in this digital learning skills. So right, everyone who is involved in the healthcare ecosystem. Secondly, also we need to see on healthcare professional or healthcare provider or worker perspective, like there are two phenomena which we can say. the buy-in approach and the capacity to learn actually. So if a person if an employee or maybe a healthcare worker, doctor, nurse, if he believes that this skill or this, this learning would going to help in their current role, or maybe it's going to help in the overall organization success. So that makes task much more easier actually. And secondly, we as a managers, we need to handhold all those frontline workers in upskilling process actually. It's a long process, it's a long journey actually. You need to send some benchmarks also, some KPIs also to see the digital, initiative results, outcomes, how we are going to move ahead in those lines actually. And foremost importantly, we need to start a culture of actually digital, in the organization actually. So it has to be cascaded down from the top management with a clear vision and everything. If I say, if I talk about my organization, definitely we started some digital transformation a year back actually. In the previous sessions, we were talking about, making a data lake and everything. So we created a data lake. Now we have a data lake. We can design, we can create different cohorts of different diseases according to the demographic, according to the disease pattern. And now we are able to connect with our patients. We have introduced a chatbot thing which helps us in tracking the patient's disease journey, how they are visiting the hospitals, about their vaccination, immunization, chronic conditions these days like cardiovascular diseases, hypertension, diabetes. So these are some of the parameters which definitely giving a boost to this digital. It's not like that digital was never existed, but still in India, if you say like 40 crores of Indian people are using digital means by some or other, like maybe online, buying the pharmacy medicines, going for the online test, taking the telemedicine consultation, or maybe interacting on a virtual support group. So it's still there, but it's a long journey to go.
Yeah, that's right. So, Kamaljeet, you have been into the force in the sense that you are leading the most important force in a healthcare, which is the nursing force. And I think this entire talk about the digitalization brings us to a very important factor in healthcare. Healthcare is all about empathy. It's all about human connect. Do you think this could be compromised if there is complete digitalization of the healthcare systems?
Very important question. I think nobody can replace a human being. Even if you get into digitalization, it should be more for your improving your processes, streamlining your automation, but no one can replace a nurse or a doctor who will hold a hand of a patient and give a beautiful smile. I think empathy is all about connect with the patient. So if we talk about digitalization, but digitalization should be done on those aspects which will improve your efficiencies, which will improve your productivities, which will give you data. That data will speak to you and that will give you data-driven decision making. It will help the management or the managers or the nursing managers to pull down their data-based reports. It will tell you the real-time factors where you're going wrong and what are you doing. But when it comes to direct patient care, human touch and human-centered approach is very important. So that is really, empathy is very important, but digitalization will help you in improving your patient outcomes, like one of them has said, and improving your quality, improving your outcomes. It will help you in collaborating and communicating with other departments because it becomes easier for you to collaborate with your other stakeholders, like for example, billing activities or quality, like you are using incident reporting, like Binu had mentioned earlier. When we were in the paper processes, it becomes very difficult for us to, track all the incidents. But now with this new software which is coming in for quality management system, I think it becomes very easy for us to put our incidents and put all the causative factors. And when the data gets analyzed, it will give you exactly what you are going wrong, where it is you are going wrong in that. So I think digitalization is important, but it cannot replace your human touch, human factor. So empathy is and compassion is very important. Digitalization can help the healthcare providers in patient empowerment. So you can empower your patients, you can teach the patients how to use these digital tools, their self-evaluation or the self-management. They can get into the mobile apps or the health apps, or you can teach them how to, manage the chronic conditions. So that way you can teach the patients how to read or how to get this digitalization benefits for themselves. So that is really very important for the healthcare providers. And the third thing is definitely the another thing about this empathy is you have to upskill your staff. So when you're upskilling your staff or your nurses or your providers, you have to, like collaborate with the academic institutions or the industry partners, and you tell them how to teach the nurses like remote monitoring devices. How do you use the remote monitoring devices? One of the typical example is your patient managed resist analgesia, PCA pumps. It's a digitalized tool, it's a equipment, but you teach the patient how to use that for their own pain management. So there are a lot of tools and equipment and digital apps which are used, but to benefit for the patients, for the employees, for the organization, but not to replace the empathy power of that. So I think that's very important.
Thanks a
Actually, I
lot.
may
And I
add
think
to it, Dr. Kausar. The efficiency of digitalization will free up time for nurses to spend more at the patient bedside to improve the human connect or the touch and the empathy part. Actually.
very well said.
Yeah.
So when it comes to empathy, I mean, we have Dr. Ashish, who I have seen very closely practicing this day in, day out, the empathy and the human connect. And I would like to again request Dr. Ashish to put some couple of pointers on this very important aspect from the healthcare perspective.
In fact, I was itching at that time to continue this, touch
I
upon
could
those.
again use my artificial intelligence that itch was visible.
So there are three things. One, definitely, is the power of human touch, which in the rate of going more and more digital, sometimes in my OPD, I am held back by one of our senior citizen that he says that, Doctor Sahab, आपने मुझे हाथ तो लगा के देखा नहीं, आप तो कंप्यूटर की तरफ मत देखिए. Sometimes they say, सर लिखने से पहले मेरे को examine कर लो. So people also know that doctors are, into the system. They start writing about the problem and the medicines, and they forget to touch the patient. So that basic, you can say relationship between a doctor and a patient, the power of human touch for a physician to actually examine, it is very comforting for the patient that at least they have felt what was the problem. And it also got reflected once the COVID got over. The amount of teleconsults happening thereafter has dropped down significantly because everybody wanted to go out, just like they wanted to travel the world. They also wanted to go out to the hospital, meet the doctor, let them examine, give us the right treatment. That was a compulsion. They were not able to do that. The physical interaction was missing, but now they are reaching to go back to the same. So there is something which always should be supreme for clinical care. That is the power of human touch. Empathy, yes, definitely. No robotics, no system can actually quantify it or make it happen through a algorithm. That is, and thank God, robotics have gone to that stage. Otherwise, all the physicians, surgeons will go out of business very soon. So that factor, it's something which is going to stay inherent to a human mind and heart, and it's continue to. But if there is a blend of that empathetic physician and along with technology backup, I think that's the killing combination. And the last thing, one has to know where you have to overrule the technology. So very great example is for the robotic, what sir was mentioning. So first few of my cases on robotic, if I was following the robot, it was leading to a mess. surgeon has to know where to follow the technology and where to follow the experience. A very fine example, a similar example, I can draw from one of the movies, Sully by Tom Hanks, where he was penalized by the board that you could have landed safely. You know, if you had decided, you got to know that there is a problem in the flight, you could have landed, because the simulator is saying that you could have landed on the ground. Why did you land on the water? So only a 38 seconds which he took before diverting. So that 38 second was not added to the simulation. The moment the board added 38 seconds, which was the time which a human mind took to take a decision and analyze on the experience, after 38 seconds, the simulator also crashed the land. So led to a crash landing. So that 38 second of human experience, the mind made the difference, and he was saved from the penalization.
That's a great story, in fact, to hear. So this brings me to the last query, which I would like to put to Dr. Ashutosh Dosh, actually. Do you think that combining the educational institutes, technological companies, and the healthcare organizations on the same page can fasten this distance to be traveled to completely become digitalized? We have already been shown the red flag by the organizers.
Yeah, it's only 2 minutes.
Yeah.
Nothing like for me, but only talking about the practical experiences. 20 years back, then when there was no digitalization, if any doctor used to see the record and see pulse 120 or 140, they used to ask about AF and VF. Now the thing is, if it is written 140 or 120, they can trace the ECG tracking what has happened actually. So this is the thing what we have achieved. And secondly, about all these things, robotic surgeries and all, means because of robotic surgery, tumor surgeries is a daycare surgery now. So now clinical research is another factor. Then there are more things which has been enumerated. So it's all.
You want to say something?
Can I add on? Right. Can I add on to what
Yeah,
Dr.
I mean,
Ashutosh
if the organizers
said?
allow, I have no
Fine.
issues.
No. So it's collaborating between the service and academics, the colleges and the teaching institutions and the practicing hospitals. The students come for practice, but they are not allowed to touch patients. There are norms and regulations. So bringing them, adopting the tech-savvy hospitals are becoming more and more attractive. They are actually a matter of status concern for the tech teaching institutes to be associated by such hospitals. So in nutshell, we should promote, because technology is still not got any place in the curriculums, in the academic syllabus, which are being taught. So obviously, the healthcare organizations have to step up in adopting these institutions, teaching them, collaborating with the students and because they are the ones who have to get job ready to take charge from us. So of course, we owe this responsibility towards them.
Thank you so much. I think let's come to the end now. So, I can actually go on and on discussing this topic, because this is such a beautiful topic, such an interesting topic. But the point is, we need to still draw the curtains. In terms of digitalization, I would like to say from the management's perspective that there are 3 major aspects which we all have been missing as of today, which initially I spoke about the ROI is not happening. Now, if I need to divide the ROIs under 3 big headings from a C-suite perspective, I think it is the technological advantage that can come from the digitalization, which is still not fully achieved. It is the operational excellence, which again can be a huge advantage for any organization who actually does it pretty well. The third can be even the strategical advantage, because these 3, any organization can actually achieve if they really shift 100% into digitalization. All that we discussed here, if these are actually taken into course and taken into implementation level, with the help, of course, with the technological companies, the healthcare will see a different world faster than the imagination. With these lines, I would like to conclude, and I'm sure any fine for overshooting the time? That's what I'm saying. Any fine for that? For overshooting the time? Any fine for that? Okay, thank you.
Can you have a huge round of applause for our excellent panel discussion, excellent panelists, for giving us insights on digital upskilling, health workforce for the digital future, and also touching base upon various aspects of digital transformation, what challenges, what are the opportunities, and what can be the way forward. Thank you so much, Dr. Kausar Shah, Dr. Ashish Chaudhary, Dr. V.R. Gupta, Dr. Karan Thakur, Dr. Ashish Shukla, Colin Binu Sharma, Kawaljeet Oberoi, Captain Sandhya Shankar, and Dr. Ashutosh Srivastava. Thank you so much. I request Dr. Kausar Shah, since you are the moderator of this session, kindly hand over token appreciation to your fellow panelists, and then we'll also give you that token appreciation. So can we have that on stage, please? We can start with Dr. Ashish Chaudhary, Managing Director, Akash Healthcare Private Limited. A huge round of applause for him, please. To Dr. V.R. Gupta, Group Medical Director, Sarvodaya Healthcare. To Dr. V.R. Gupta, yes. To Dr. Karan Thakur, Group Lead, Sustainability and ESG, and Vice President, Indraprastha Apollo Hospitals. Dr. Karan Thakur. To Dr. Ashish Shukla, Vice President, Operations and Strategy, Regency Healthcare. To Colonel Binu Sharma, Senior Director, Nursing, Max Healthcare. To Kawaljeet Oberoi, Group Chief Nursing Officer, Paras Health. Captain Sandhya Shankar, Corporate Chief of Nursing, Fortis Healthcare. And to Dr. Ashutosh Srivastava, Medical Director, Aditya Birla Memorial Hospital. I request Sangamitra Mohanty to come on stage and hand over token of appreciation to the moderator of this session, Dr. Kausar Shah, Senior Vice President, Max Healthcare. Thank you so much, all of you, for joining us today. That brings us to the end of the 6th edition of National HealthTech Innovation Conclave, organized by APAC News Network, presented by Iron Mountain and powered by Schneider Electric. Also, I'd like to thank our other partners, Gold Partners, Cloud4C, Ruckus Reddington, Associate Partner, Trimit, NGO Partner, Willing Happiness, and supporting partners, National Health Authority, Heights and HSCC, and of course, country partner, Embassy of Sweden, New Delhi. And we also now have to announce 2 lucky draw winners who have been part of this conference since morning. Hopefully they both are delegates. Are here also, yes. So the first name is Shikha Rampal, Head of Operations, CK Birla Hospitals. Is she here? Okay, we can find then another. Seema Yadav from CK Birla Health. She has also left. So both of them are the bad luck. And Arun Kumar Sa from Paras Hospitals. He is here. So one more we can. And one more name I can announce because 2 have been rejected. So Tanisha Raheja, Deputy Manager, Max Healthcare. Yes. Yes, she is here. So Max and Paras are the winners of the lucky draw. Thank you so much, all of you. Do join us for an interesting event on the government sector, which APAC is organizing on 11th and 12th of August in the beautiful city of Bhopal. That's the 4th edition of APAC's India Digital Empowerment Meet and Awards, Madhya Pradesh edition, hosted by the Department of Science and Technology, Government of Madhya Pradesh, and organized by APAC News Network. Do join us in that conference if you have any interest to reach out to the decision makers in the government ecosystem. Thank you so much. With this, I'd like to invite Neha Pal from APAC Healthcare to give vote of thanks. And then I'll request all my APAC colleagues to come on stage for a group photo as well. Thank you so much. Goodbye. Take care.
So as we draw close to on this remarkable National Health Tech Innovation Conclave, I would like to extend my heartfelt thanks and gratitude to all the speakers, delegates, and the partners who have made this event a grand success. This event would not be a success if I'll not appreciate the team who was working behind this conclave from last 2 months, and they need it is the time to extend my heartfelt gratitude and appreciation towards them, starting with Nikhil Lakhera, Shrishti Bharti, Neha Sharma, Alice Purti, Ritu Sharma, Suman sir, Sanjay sir, Rajneesh sir, Rahul Kashyap, Piyush, and Chirag. Last, certainly not the least, the 3 pillars of APAC News Network, Souvik Goswami, Sangamitra Mohanty, and Gopi Krishna Arora, because without their leadership and guidance, this conclave would not have been possible and even a success. Thank you so much. Keep supporting us and keep